This is Nikki Casey with Matt Connerton, Unleashed in the Afternoon, and I am here with U.S. Senator Maggie Hassan here in Manchester at the opening of her office. Maggie, I'm just wondering, how will the cuts to the social services under the Trump budget impact the recovery community in cities like Manchester?
Well, I am very concerned about what we've seen from President Trump in terms of his budget proposals, as well as some of the other proposals that will undermine prevention, treatment, recovery, and law enforcement efforts in New Hampshire and around the country when it comes to substance misuse. So the effort that the White House and the Republicans in the House made to repeal the Affordable Care Act would have repealed our bipartisan Medicaid expansion program in New Hampshire, which has been critical in providing substance misuse treatment. Similarly, his proposed budget, which we are told is just a draft, makes really deep cuts, for instance, to the National Institutes of Health, which does critical research on substance misuse and on the type of practices we know we need to engage in to help people in recovery. And then there are other budgets that he has proposed making really drastic cuts to our community development block grant programs, for instance, which provide such critical funding for affordable housing. And one of the things we know is really important for people in recovery is to have housing options. So all across the board, it's a particularly challenging and difficult budget for those of us who are trying to fight this epidemic and help people get to recovery. Last thing I'd mention is the repeal of the Affordable Care Act, if it were successful, would have repealed something called essential health benefits. What that really is a requirement that private insurers as well as public programs actually cover substance misuse treatment. So if you have private coverage, we think it should cover all illnesses, and substance misuse is an illness and it needs to be covered. And so the president's proposals in that regard are very, very troubling. You know, the president has talked a lot about how moved he was by seeing the impact of the heroin, opioid, and fentanyl epidemic in New Hampshire when he was here as a candidate. And the problem is that his actions so far haven't lived up to those words. So we will keep pushing to make sure that we have the resources we need here in New Hampshire and around the country to help people beat this disease and then get stronger.
Thank you very much.